Doctor. There are 8 types of registration. To manage and treat patients in the UK, a doctors must register with the General Medical Council, GMC. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area, EEA, member states. Full registration is for doctors who have completed the year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent equivalent or years clinical training in the UK. A specialist registration is for doctors who have completed specialty medical training and have a certificate of completion of training, CCT. The GP register is a register of all house eligible to work in general practice in the NHS. Letter C, PLAB. Before they can obtain full registration, some categories for overseas doctors are required to take the Professional and Linguistic Assessments Board, PLAB, test. PLAB is designed to ensure those who pass can practice safely at the level of an S for an SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 in an objective structured clinical examination OSCE. It consists of 16 5-minute clinical seniors, known and station to assess professional skills. Letter C, PLAB station and advice. OSCES assess these skills. Clinical examination, your ability to carry out a physical examination of a simulated patient and actual training to play this role will be assessed. Uncomfortable or intimate examination will be carried out using a mannequin and anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Communication skills. Your ability to interact with a simulated patient in some cases the examiner will assess. Skill tested may include breaking bad news and giving advice of lifestyle. History taking. Your ability to take an accurate history and make a reasoned diagnosis will be assessed. Advice on testation from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Keep in mind safety precautions like throwing the sharps in the sharps bin. Don't forget the ABC Airways breathing circulation protocol in every emergency station. Check the patient, understand what is happening, then ask them about any concerns they may have. Don't just give a lecture. Listen careful to what the lecturer says. Note, sharps are needles and blades which must be disposed of safely in a special container called a sharp bin. Exercise 15.1. What in the registration night might these doctors obtain? Look at A opposite to help you. 1. A newly qualified Spanish doctor provisional registration. 2. A newly qualified Nigerian doctor limited registration. 3. A doctor who has successfully completed the first foundation year FY1 full registration. 4. An SHO who has successfully completed the foundation program and gaining a certificate and gain a certificate of completion of training after several specialist register post specialist registration. Exercise 15.2. Write the abbreviations in words. Look at A, B, and C opposite to help you. 1. Any doctors who wants to work in the UK must register with the GMC, General Medical Council. 2. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. 3. Part of the test consists of an OSCE objective structured clinical examination. 4. In any emergency, remember the ABC protocol, airways, breathing, circulation. 5. Before you can obtain specialist registration, you must have a CCT, Certificate of Completion of Training. Exercise 15.3. Complete the test. Look at A, B, and C opposite to help you. My name's Musa, and I come from Yemen. I came to the UK about 2 years ago after graduating because Yemen is outside the EEA. I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on foundation program. Although I speak good English, I had to take the FLAP test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling stations, you should simply memorize a set of first. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty, sorry, pediatrics. As hospital now have a demonstrate there is a suitable candidate from the EEA. Once, if completed my second foundation year, I shall obtain a CCT, which will allow me to proceed special registration with the GMC, an important step on the road to becoming a pediatrics consultant. Thank you.